Welcome everyone, and thank you so much for coming out this evening. I'm Sherry Faber. I'm with Janesville Mobilizing for Change and with the Rock County Trauma Task Force. For the last 2 years, I've been working on a grant through the Office of Women's Health, which is a department of the U.S. Department of Health and Human Services. And that grant is, the goal of that grant is to reduce one of the primary risks for women abusing opioids, which is childhood trauma. So thanks to some of the funding from that grant, we brought you this panel this evening. We'd like to thank Community Action for providing this space for us tonight, and Mark Perry for agreeing to be the moderator. There he is. Thanks, Mark. Thank you also to our panel participants who will be introducing themselves as we go through our panel members this evening. You should have received a green index card, which I think I explained earlier. If you have questions, you can write those on there and pass them to the end of your rows, and we'll be picking those up later to ask questions of the panel members. Now I'd like to introduce Tanya Ramsey. She is the owner of Life by Design Counseling. She's going to be doing a brief presentation, sort of an overview of trauma, and it's really hard to do an overview of trauma in a short amount of time, so we really want to thank her for her efforts tonight to give us a presentation. Thanks, Tanya.
Thank you, and thank you everybody for coming. I'll turn that down. I told Sherry I didn't wear my tall shoes today, so. So we're here tonight to talk about trauma, and the first thing is just let's define it. What is trauma? So the American Psychiatric Association defines trauma as exposure to the actual or threatened death, serious injury, sexual violence in one or more of the four ways. So directly experiencing it, witnessing it in person, learning that the event had happened to someone close to you, such as a close family member or a friend, and experiencing repeat exposure to trauma. So when we're talking about that, we're thinking about first responders. So this experience overwhelms a person physically and psychologically. So that's how we kind of go with the definition of trauma. So there's many different types of events that can cause trauma. And of course, this isn't an extensive list, because that list can go on, but natural disasters, hurricanes or floods, think Hurricane Katrina. Those people definitely went through a very trauma experience. Abuse, domestic violence, crime, we're all just kind of seeing a lot of stuff in the news, what happened in Texas, last week. So those kinds of experiences, war and combat, witnessing violence. And of course, the list is much more extensive than we had to put on a slide. So some other kind of facts about trauma. In the cases where trauma is related to like a natural disaster, like Hurricane Katrina, there's like this outpouring, the comfort to help those people that have been affected by that. But other forms of trauma, like assault or abuse, rape, those are often hidden and kept in secret, which can lead the people that experienced it lead to shame, feeling invisible, even rage, some really strong emotions. Women can be re-traumatized just by, the standard operation of how the criminal justice system is set up, although there's some really good improvements being made. No two people experience trauma the same way, and their responses will also be different. But the big important message is that you can heal from trauma. So how does trauma affect people? Well, it affects their safety, their internal safety and their external safety. They just don't feel safe. There may be some sleep issues. They're either having nightmares or their mind just keeps going. They can have flashbacks of the trauma, problems trusting others, which really makes it hard to form relationships, healthy relationships. They may experience depression, anxiety, panic attacks, feeling out of control. They can't stop crying. They're so angry, they don't know what to do with the anger. Unresolved and untreated trauma can lead to a lot of physical problems, and I don't think people always make that connection, that if you had something traumatic happen to you and you didn't get help, physically your body responds to that the longer it goes on. And trauma makes changes in the brain that have actually been documented. So how can people heal from trauma? Find a support group. There's a lot of support groups. There's some power and comfort in knowing that you're not alone. Work with a professional, a counselor that is trained in the treatment of trauma. Good self-care is always a really important piece. Good self-care is, we all need that, right? For people that have been traumatized, self-care is more important and more needed to help heal. It's important to create internal and external safety so that that person that's gone through that traumatic event can feel safe in their own space. It'll be helpful for them to help manage all those emotions that they're having that make them feel really overwhelmed. And applying coping strategies to manage stress, to manage, all the other things that are going on as people are healing from trauma. So I included SEEDS in here, and this is actually 5 factors that through neuroscience research was developed. I actually first was introduced to SEEDS through a curriculum, a trauma curriculum that I teach. And so SEEDS stands for social connectivity. It's important to have healthy relationships to help our brain and help ourselves heal from trauma. Exercise. Exercise has a lot of benefits to mood, and even 30 minutes a day can make a really big difference. Education. Learn something new every day. It helps keep our brain engaged. Diet, eating foods that nourish the brain versus starving the brain, so some good nutrition. And of course, sleep. Sleep allows our body and our brains to regenerate every day. So if there's big sleep problems, we're not getting that regeneration. So, trauma is a very complex, and it's also subjective. So what's traumatizing to one person is may not be traumatizing to another person. Everyone's going to experience it differently. It's important to understand how adverse childhood experiences can affect people later in their lives, because then there's a chance for early interventions and even prevention. A better understanding of trauma can help prevent people from being re-traumatized. And so it's so important, and it's one of the big reasons we're all here tonight, is to let our communities know what people in the county have been doing so they can look through that trauma lens. The last one, trauma-informed practices, can help professionals in all areas look through a trauma lens. And so that's why we're here today, and I thank everybody that helped make tonight happen. And so now let's move on to our panel.
Okay. So, welcome everyone. My name is Mark Perry. I have the privilege of being your moderator this evening. Really looking forward to this panel, having this opportunity to learn from some experts in our community. I hope you all are ready to hear from some really amazing people and hear from their experience, and we have this great opportunity to learn from them. So I want to thank our panelists, Kate Luster, here we go, Michelle Brandonmule, There we go. Katie Clarequist, Kelsey Hood Christensen, Kelly Everson, Brent DeReamer, and Denny Luster. Each panelist in a moment is going to get a chance to introduce themselves and give you more information. We're going to start actually with a question to introduce you so they can introduce you to their work. So the question for the panel, and we'll go in the order, we'll just follow the order from first to last, or last to first. Number one in my heart, though. All right. As the question reads, please share how an understanding of trauma has changed the way your organization operates, and give an example of a specific trauma-informed practice you have implemented.
Okay, I will start by just simply saying, while it says I represent the school district of Janesville, I specifically am a school counselor at Franklin Middle School, so I can speak a lot to what myself and other colleagues within our district have done. There are certainly a lot of things that happen within our district that I'm not fully aware of. So I kind of went through the list of things that I'm aware of and checked in with some of the other individuals, but more personally, I can speak to kind of what I've done and things that have happened in my specific building, but that have filtered in throughout the district as well. I think just the understanding of trauma, the awareness of it, the increase of the awareness within our staff certainly has created a safer environment, which we know is key to that trauma and helping with the lessening the re-traumatization or problems along the way. There's been a lot of development of protocols and procedures that are in place for teachers and staff when dealing with challenging behaviors. We've really tried to take the approach of developing the sense that things that we do that are best practices in our classroom are good for students that have had trauma, but they're also good for students of any background. So I've really been a proponent of we just need to be doing what's best for students, and that's going to filter into what's best for students that have experienced trauma. We don't always need to ask the question of who in my classroom has been traumatized in some way, but how can I be making sure I have a safe environment for everybody? In a classroom, it's the consistency and routine that is beneficial to all students, and especially to students who've experienced trauma. So that's been one of the biggest things that I try to stress and make sure that other educators understand as well. Some of the specific examples that I can share relating to things across the district as well, specifically to our building. We currently have 9 educators within our district that are trained through St. A's on the 7 essential ingredients of trauma-sensitive schools. I'm one of those trainers. We do multiple PDs or professional developments throughout the year for our staff. I have been trained now going on my 3rd year. I was one of the first trainers. And I would say in the number of times that I have done it, we see not just teachers, but we have paraprofessionals, we have office staff. We try to encourage as many of the staff members because we all know it's not just the teachers that are dealing with the students, it's those that see them in the hallway, it's those that see them in the office. So we've really tried to incorporate those PDs offerings for all staff, not just specific to educators or teachers. Myself and a couple of the other trainers are working on developing this year a refresher 7EI. So those teachers who have or staff who have taken it in the past, it's one of those things that, and I've been researching, learning, relearning about trauma for 5 or 6 years, and you can go and hear the same things, but when you hear it a second or third time a little while later, or you have a different experience, you definitely connect more or remember more. And so that PD of refreshing, you may have taken the 7EI, last year, but you still need to kind of remind yourself in those times of the good qualities and the characteristics you need in your classrooms. We also have had a number of staff that just do their own. I'm very fortunate to be in a building that has a couple of other staff members who are very, what we call trauma geeks and do a lot of focus on trauma in our building. And so we've developed a lot of our own personal PDs with our staff themselves, and have been given support from our administrators to have half-hour PDs once a month that we were able to just incorporate things with our own building. Other district focuses have included book studies. We've done the brain architecture, if anyone is familiar with that, participation experience of understanding trauma. We had a staff, a group of us that were awarded a grant to go and visit Brockton, Massachusetts, which is a school district that really has some significant, has already had quite a lengthy time of working on trauma-sensitive practices and infusion in their schools. So we were able to take some things from them, learn from them, and develop things in our own schools now. We have regulation rooms, calming down corners, tools and things for teachers to be using within their classrooms. We have 3 educators that are also trained in the youth mental health first aid, which is that's an opportunity for staff and community to be involved in. We also have a few staff that are working on training therapy dogs. So that's been something that's we've been working on in a few of our buildings. And then we've also, through JM4C in Rock County, been working with Handle with Care, and that was a big initiative last year that I think had made a big improvement on keeping our staff involved in knowing that things happen, but we don't have to know what happened, we just need to know the kind of sensitivity to have to those students when they come through our doors. I think that's about it for me.
Thank you.
Hi, I'm Kate Lester, and I'm the Director of Human Services. And so the Human Services Department for the county oversees child welfare and juvenile justice services, mental health and substance use, aging and the Aging Disability Resource Center, the economic support services, so Medicaid and food share, and so all of those benefits. And so kind of a public safety net of a wide variety of human services. And we've had, for several years now, an effort underway to implement a strategic plan within the department around improving our organizational health related to trauma-informed care. And interestingly, when you are trauma-informed as an organization, you are just really healthier as an organization. And so we've tried to be pretty systematic and organized, knowing that it takes a while to make some of those changes, but I just thought I'd hit some highlights and share some of that with you tonight. So among our guiding principles when we're looking at how to be strategic in a really large organization, we think about just everywhere it's really important to recognize the impact of trauma. So that means with our clients, it means with our staff, and among ourselves. And so a big theme has been understanding that parallel process of if we want our social workers and staff who are out in the community every day doing really hard work to be trauma-informed and to be client-centered and responsive to what's happened to someone, then we need to be an organization that cares about what has happened and how our staff are experiencing their work environment and their relationships and their jobs. And so we're working hard to really make that an authentic connection between how we are at work and what we're asking with our clients. And we did a couple years or so ago now, kind of department-wide, we have over 400 employees in the department-wide training on just the fundamentals of trauma and trauma-informed care. And we did anonymous ACE quizzes for all of our employees, just as a way of helping to provide awareness and education. And we learned that the average ACE scores of the employees of our department are higher than the average ACE scores of the county in general. And if you know the data on Rock County's ACE scores, they're among the highest in the state. And so we know that we have a workforce who has experienced adverse stuff, and that we need to be aware of that and to create a culture that is welcoming and responsive about that as well. We focused on safety, and again, this is about safety for staff, ongoing thinking about how can we help staff be safe in the community in their work, but also how can we be safe in the workplace and physically safe, but also psychologically safe. So that culture of, is it safe to say you don't know how to do this, or to disagree, or is it safe to have a different opinion, and how do we create a culture where that is part of what we're doing? So we're working on that as well. Focusing on just a principle around client engagement and choice, and trying to be create opportunities for the people who we serve, who have often been traumatized and many times don't have choices about working with us. how can we increase opportunities for choice in control in their interface with us. Big focus on secondary trauma and stress for our workforce. As I mentioned, we have a critical incident response team model internally that is a great resource for staff. It's peer-led for staff to be able to tap into when they have felt stress related to work. And then an emphasis on trauma-specific services. We deliver a lot of treatment, a lot of support models, and really trying to stay on top of and paying attention to what the evidence says works. And what are the trauma-specific services and treatments and interventions that are likely to be most helpful to the folks that we serve. And so we've tried to integrate those trauma-specific services across the board. We have a lot of work to do yet, but that's just a general framework of how we've tried to approach being a trauma-informed organization.
Thank you. Go ahead, everybody.
My name's Michelle Brandemule. I'm an assistant state public defender. So the State Public Defender Office is a statewide agency, and then specific offices cover specific counties. So I'm in the Rock County office. We provide legal representation to people whose income are under the federal poverty guidelines. So as a statewide agency, we like to practice trauma-informed services, and I think that comes in a lot of ways. So we really focus on client-centered services with our clients. That means that we really focus on our interviews, our initial interviews, to really get at who this person is. Obviously, we get a charging document if we're talking about a client who's being charged with a criminal offense. There's a charging document about something that happened. In our interviews, our goal is to look at who is this person? Who is this person? What have they been through? What is their story? And a lot of that is through creating an environment for our clients where they feel comfortable telling us their story. And then using that information I think we see it as our job to show other people that this person is more than this charging document, and there's a lot more dynamics that come along with human beings than just what happened. And I think that information also informs what should happen, what should be the outcome of certain, like I said, if it is a criminal charge, it can inform the decisions about if we're looking at treatment as an outcome, what kind of treatment is going to, best help the rehabilitation of this person. As a statewide agency, there are people who are always trying to keep on top of the newest data, research, studies, and then they'll share that with all of the different offices so that we can stay informed about the research out there. I participate on the Rock County Trauma Task Force so that I can stay up to date on research as well and use that information in my advocacy for my clients. Another, practice more locally, but as an agency, so one issue that we've looked at is what you would call the indiscriminate shackling of juveniles. So I represent both juveniles and adults. And in some states, there are statewide policies that have already addressed, and I guess when I say indiscriminate shackling, that just means every juvenile, shackling and handcuffed, every juvenile treated the same way. When they're in court, they're handcuffed or shackled. And in Rock County, the practice was every juvenile's handcuffed and shackled in court. In Wisconsin, the change that's being pushed is happening on a county-wide level. So someone taking it to their county, to their courthouse, saying, I think that we should look at this. And the push behind it is a trauma-informed reasoning that we can assume a lot of the kids, a lot of the clients that we are working with have experienced trauma in their lives. And so the idea of having them handcuffed or having them shackled in court can re-traumatize, especially children, many of the times. And so here in Rock County, we've started addressing the issue. We've been working together with the Sheriff's Department, the District Attorney's Office, and the courthouse, and of course the juvenile judge here, and been creating policies so that we can make individual decisions about each kid. So does this specific child pose a risk of, trying to run from the courtroom or having some sort of crisis? And if the answer is no, then at this point, the point where we're at is that they're not handcuffed in court. We are still doing the foot shackles, but our goal is to get to a place where everyone feels comfortable that if we don't have concerns about that kid, they're not in any sort of restraint in the courtroom. So I'm proud of the work that we're doing with that, and I'm excited about getting to a place where we can say we're one of the first counties that have, where a child can be not shackled or handcuffed at all. And I know there's legislation on the statewide level where our statewide agency is advocating to try to make that change statewide. So I think that's all I've got for the first question.
Thank you.
Thank you. Hello, my name's Kelsey Hood Christensen. So I am the Director of Survivor Empowerment Services at Family Services. So I see the oversee the sexual assault advocacy services in Rock and Greene County and the domestic violence advocacy services in Southern Rock County. So I would say what we've done to incorporate trauma into our program is that we've really tried to focus on meeting the survivor where they're at and focusing on the empowerment-based services. By nature of our services being geared towards survivors, we know that everybody we're working with has experienced trauma in their past, but we also understand that that's not always directly in relation to the sexual assault, human trafficking, or domestic violence, but we frequently see histories of childhood abuse or other forms of trauma that are coming forward. And we also recognize that everybody experiences their trauma differently and perceives that trauma differently, and it impacts them differently. So instead of having standard services that we kind of shuffle everybody through, we've really expanded our programs to be able to incorporate what the survivor wants to receive from our services. So are they looking to meet with other survivors and become connected with a movement? We try to facilitate that. Or are they interested in meeting individually and working individually on coping skills or whatever that may mean for them? That's what we try to meet. That's what we try to meet and work our services around. We've really looked at trying to make our services more mobile. So previously, it may have been at a single office, but we've really looked at expanding our services around the county so that we can come to wherever that survivor has identified a safe space to be, whether that is in the library of their local community or is somewhere else. We want to make sure that they feel safe where they are working with their advocate at. We've also started partnerships that may be places you wouldn't traditionally expect to find survivors, but we've recently started going into the jail and working with survivors in there, which again isn't somewhere you feel that you would find your advocates, but we know that there are survivors there. So we've began to expand our services in that manner. We've also focused on training our staff in areas that, again, don't seem directly related to victimization, but research has shown or we have experienced a high rate of intersection. So substance abuse is a large one that a lot of our advocates have been seeking training on and trying to understand, because we know there's a high intersection with being victimized and experiencing substance abuse. So we've tried to expand our knowledge there and engage the community in that way and see how we can work to address those needs. We've also had a number of survivors who've pursued more education on mindfulness and things like that so that we can incorporate that into our work. So our advocacy work, again, is not just geared on coming in and talking about the victimization, but what are your needs in relation to this and what are your goals? So we really focus on incorporating how the survivor wants to work through this, what needs do they feel they need to navigate, and how can we create a safe space, whether that is emotionally safe, physically safe, in any way that manner. That's what our services try to incorporate. Of course, we also have to look at the trauma experience by our staff, and as sometimes first responders, as we respond 24/7 to the county in any area, we look at that, and we've tried to also incorporate that staff recuperation time, that self-care, the flexible schedules, things like that. So looking at trauma from both angles with those we are working with and those who are also providing the services. So.
Thank you. Hello, I'm Denny Lester. I'm a licensed professional counselor in the RECAP program. For those of you who don't know what RECAP is, it stands for Rock County Education and Criminal Addictions Program. It's a treatment program in-house in the jail. We have anywhere from 25 to 40 inmates there. Back in 1992, the Sheriff's Office had the foresight to be able to see that people needed treatment, not just merely being housed in jail and waiting their time and paging themselves through calendars until they got to the date where they could actually be discharged. So we have a treatment program in which we work with a lot of people, a very high percentage of whom have substance abuse problems. So we know that they're self-medicating because of the trauma they have been through, very high percentage of trauma. We have the inmates do an ACE survey when they come into the program. I'm of the belief that nobody chooses to become an alcoholic or a drug addict. It's not something that they have as a goal in their life. So one of the things that we try to work with them on is through trauma-informed approaches is trying to help them address what's the underlying trauma, what have they been through that they can start to address at their own pace. Being sensitive to going at their own pace, also having cultural sensitivity from where they're coming from, the culture, the background that they're from, and trying to help them address what they have been through, because that tends to be what caused them to self-medicate in the first place. To me, it's like picking dandelions. If you pick the dandelions, but you don't pull out by the roots, the dandelions just grow back. And lots of times people just go back to using because they really haven't got at the root of what caused them to start using to begin with. So with that in mind, that's been our approach. The program itself addresses things such as anger management, restorative justice, thinking for a change. We certainly have an alcohol and drug class as well. They have individual counseling. And in addition to the individual counseling and group therapy that we do, we also have the sexual assault and recovery program and the Beloit domestic violence coming to our program. Like Kelsey said, they have been a wonderful addition to our programming. They have helped a lot of people who have either been through their own abuse or neglect or domestic abuse, or because of someone they know that has been through a loved one, maybe a child that's been sexually abused. So in that sense that we try to validate their experiences, because lots of times they didn't have that. And so that's kind of the things that we're doing. We realize that a lot of people that we work with have a lot of emotional reactivity. They can be very quick to be angry, but likewise we can have a lot of people who have emotional detachment, almost like they don't have a lot of feelings. There's lack of emotion, but those are also people who have had trauma in many cases as well. So we can't just look at the ones that have the emotional reactivity. So we've had staff train on the ACEs, what that's all about, in terms of how we approach people, in terms of that sensitivity that I was referring to. We have books that they can read that can address trauma, behavioral therapy. So those are a lot of the different things that we're doing to try to make a difference, to try to help them. And we have found that to be quite beneficial. So that's pretty much it. I would say, though, this is something that we require constant education on. It's not something we're going to get trained and all of a sudden we know it all. This is something that's evolving. It's going to take time. And so we are committed to continuing our education in that area by going to conferences and workshops.
Mm-hmm.
Thank you.
Thank you, Denny. He pretty much segued right into the Rock County Sheriff's Office. I'm Captain Brent Dreamer. I'm a captain of the Sheriff's Office. I presently oversee the RECAP program as a captain. I also oversee our Huber, and the sheriff, Sheriff Troy Knudsen, has now assigned me to the rehabilitation reentry programs for the Rock County Sheriff's Office. I'm going to start off with a little different approach. I like to tell stories. Typical, right? I have the gift of the gab. Sometimes it's a curse. So, I started over just under 30 years ago with the Rock County Sheriff's Office. When I became a deputy sheriff, my job was to go out and arrest the bad people, right? Bring them to jail. That was my job. That's what I was trained to do, and that's what I was taught. 30 years ago, that's what we were taught. We go out and arrest bad people, bring them to jail, and we warehouse them, and that's what we did. Well, after several years of doing that, it's all of a sudden dawned on me, I'm arresting the same people over and over, and sometimes the first, second, and third generations of the same families, and I'm bringing them to jail. And I'm thinking, why am I doing this? Why do I keep doing this? Because the way the justice system is, we bring them to jail, they might be out 2 or 3 weeks later, and I arrest them again for the same type of crimes, and it's just a vicious cycle. So I started thinking about other ways of looking at this. And then, as everybody on this panel has said up to this point, why are they committing crimes? Why are they doing this? And it goes down to what cause usually. And that what cause, after 30 years, we realized is some kind of trauma. Now, whether that be physical abuse, sexual abuse, alcohol abuse, domestic violence abuse, substance abuse, whatever it might be, is usually what the problem is. Now, in law enforcement, we kind of didn't do that right away. We would just arrest people and bring them to jail. So it's something we had to learn, and it's something we are presently learning. So then we started talking about treatment. Well, we're very fortunate in Rock County that we have a drug court, we have an OWI court, and we have a veterans court. We're one of the few in the state that has all 3 courts in this state. And we're very fortunate because people in this state, a lot of people at this table, and a lot of the agencies that have talked already, have come together and collaborated and said, we need to do something about this. So that's where we're at right now. Well, then we started treating people. But like at the jail, we treat them, and we try to help them, and then we go, well, your time's up, we have no more control of you, so have a good life, send them back into their environment. And what happens? They go back to their old ways and they come back to us again. So then we finally took it one step. For many years I've said, how about aftercare? What can we do to help people with aftercare? So we finally decided now, with the reentry programs and the programs we're doing now, reentry is becoming a very big issue right now, or a very big thing that we're working on. I don't know what's going to happen after that. I'll be long gone retired by the time that happens. But I think it's my whole point to this whole story is 30 years, folks. 30 years it's taken us to get from that point to where we are today. 30 years to understand human beings and the way people think and why they do what they do. I don't say that as a sad thing, it's just it takes us that long to learn. And as Denny said, it's going to be a continual learning. It's a living, breathing thing that we have to constantly change and learn and see what happens. And it's going to be 5 to 10 years down the road before we really see how reentry works. And we hope it works well. And we're really trying really hard to do so that's kind of the end of my story, but that's where I've come from. And that's taken a big change, because it said it's hard to give up going out and arresting bad people and bringing them to jail. They're learning that you got to look at why they're coming to jail and start looking at that, the root causes, and then try to treat those so I don't have to keep resident. Basically, I'm talking myself out of a job, and that's okay. So, some of the things that Rock County Sheriff's Office has done, you've heard a lot of them already. We've been I'm part of the Rock County Trauma Task Force also. We've had the Handle with Care program, our deputies are trained in. Trauma-informed care, our deputies are trained in. Our drug-endangered children, we're trying to work with that so we can look at, many times we've done SWAT calls, but I've had to kick in doors, and I've had children laying on the couch and they don't move until I shake to wake them. That tells you something. That tells you that they're used to that kind of traffic in their homes and what's going on. So back in those days, we arrested the parents and called protective services for the children, but we never did anything with the children. So we had to learn to change that attitude. CIT training, crisis intervention training, ACEs training, a lot of our deputies have been through. We're doing things in the jail such as NAS, needle abstinence syndrome, training for our females for using drugs and having babies and how it affects the babies. We're just starting looking at a parenting class in our jail to also help parents who are in jail that need help, because again, we go back to trauma. A lot of this stems from some kind of childhood trauma, so we want to start working on that now. And while they're in jail, let's help get them that treatment, help, so when they get out of jail, they can continue with that and hopefully learn from it. So that's about all I can say. It's a lot of changes, a lot of huge changes, a lot of different thinking for us in law enforcement. We're one of the first ones to see a lot of the trauma, but my hope and prayer is that everybody out there, John Q. Public Citizen, Jane or John, will recognize, see something, and understand why that person's doing what they're doing, and be able to let us know too. So when we show up, if I'm dealing with someone that has a mental health incident or lapse, I don't take them to jail. I take them somewhere to get help. And that's what we're looking to do, and that's what all this training is about. So, long time coming. and I'm praying and hope that it gets going farther and that we learn how to do this, and it's changing the way law enforcement is looking at how to treat people and how to deal with people in the community. Thank you.
Hi, I'm Kelly Everson, and I am a therapist with Statewide Mental Health. We are a small, well, not so small anymore, we're growing, but we are a private mental health clinic here in Beloit. We have, I think, 14 therapists on staff. And I feel like we do a lot to try to address the mental health. Like Brent, I come full circle. I've been working in and around Rock County for the last 30 years. I've gone from human services to the school district to now working full-time in private practice. And all of the work in all of those settings has created the place that we are at now. Because 30 years ago, we lock them up first and ask questions later. We know that that does not work. That creates this cycle that we are all dealing with today. So it has taken us 30 years to get here, but we have to keep moving forward. And so that I appreciate. And I think that's really the position that our clinic has taken. We have a lot of veteran therapists on our staff who have also gone full circle, and we understand the importance of trauma work. We try to meet people where they are. And one of our huge initiatives that we have jumped on board in the last couple of years is school-based mental health services. It's our job to help eliminate the barriers. You know, people are unfortunately incarcerated, so we bring in programs to help them. Well, our children, you know, we want parents working, and then when they work, they can't take off to get their kids the mental health care that they need. So by offering mental health, school-based mental health services, we bring the services to the school district, and therefore we're eliminating some of those barriers, and we're also making that connection to school staff, because we're there to be able to consult, to be able to help a student in their natural environment. When I go into my office for an hour session, it's a very benign atmosphere in that anyone can kind of hold it together for that hour. But when we have our therapists right there in the schools, they're seeing the children in what would be their natural environment. So we work with six different school districts in Rock County, and we're very excited about all of that work. In addition to that, we also think time is of the essence. When an individual feels like that they need mental health services, you know, you gotta strike while the irons are hot. And for me to schedule an assessment that's 4 to 6 weeks down the road is not necessarily what individuals need. So we pride ourselves on trying to get people in within 2 weeks of an intake call, and I'll be honest, a lot of times it's within a week. Sometimes that insurance industry, anybody here from the insurance industry? Sometimes that barrier is a barrier, and that kind of slows up the process. But you know, we understand the importance, and sometimes we will rearrange our schedules in order to get someone in a little bit quicker. We've also realized that each individual person that comes to us is different. They, as Tanya mentioned early on in her presentation, that everyone experiences trauma differently, and everyone needs a little something different. So we've really prided ourselves on making sure that our therapists, who are both licensed professional counselors like Denny, but also licensed clinical social workers, that they bring different skill sets to the table. We have several people that have been trained in EMDR, which is an evidence-based training that works with dealing with trauma. A lot of people can connect that to working with the military veterans. It also works with lots of other mental health disorders. We have several therapists who are trained in brain spotting. We do some of the more traditional, for us therapist people, cognitive behavior therapy. We have several staff on board with us that are certified to treat alcohol and drug addictions. So we try to bring a wealth. We also now have a therapist that specializes with eating disorders. While the numbers aren't as high statistically, there's not very many clinicians in the area that provide that level of service. And we also, most of our therapists come from a brain-based perspective. We understand that neuroscience plays a part in trauma. And I can keep trying things and trying things and trying things, but if I understand how the brain works, I have a better chance of providing an intervention that is helpful to that individual. I just know that we can't keep doing things like we've always done. And so our clinic is, in fact, our leader is very passionate about community outreach, which is why we're here tonight. It's why we're involved in HealthNet. It's why we've partnered with the YMCA here in Beloit. And we strive to continue to do that, because the more this message gets out, the more people can heal.
All right, so thank you all for sharing. One of the things that I really appreciated hearing from everyone on the panel was talking about meeting people where they are and seeing the individual. The thing that I appreciate most about trauma-informed care is that it's in step with the best practices of cultural equity and cultural humility, which is also about seeing the individual and meeting people where they are. So thank you all for that. Yes, please. When you talk about coming a long way, that's a big deal. Seeing the individual and understanding that we're not all the same and that we don't all experience trauma the same way. So that understanding alone is a huge step. So we will get a chance for all of you to ask some questions, but I get that opportunity first. So I'm going to start with this question. Can you share an example of when using a trauma lens to look at a person's behavior helped you in your work with that person? And I'm going to specifically direct that question at Kelly and Michelle, but anybody on the panel can answer. So, or Kelsey and Michelle.
Yes. Thank you. So when I think of one of the survivors we worked with recently, that was a wonderful example of how positive trauma-informed care was in working with them, is we were recently working with a teenage survivor of sexual assault and physical abuse at the hands of her partner. And when SARP was invited to work with this survivor, she was being interviewed by law enforcement, and so she came in to report, and then while there, just kind of shut down and didn't want to. So SARP was invited in to come work with this young woman, and I think, so people who were not looking, somebody who wasn't looking at services to this person through a trauma-informed may have been focused on, you're here to report, we need to catch this perpetrator, we need to focus on getting you to report, we're staying in this room until you tell us what happened. And so the advocate who responded, that was not the perspective that they took in working with this survivor. The survivor actually did not report that day, but continued to work with the advocate beyond that. And so what the advocate recognized in that instant is that there was something in the survivor's mind that in that moment, in that investigation, in that interrogation, that I felt unsafe. That was what her mind was screaming to her. I'm unsafe, I'm unsafe, I'm unsafe. And so what the advocate did over a course of a few months was build a relationship, and was to help identify what in those moments made you feel unsafe. How can we build that safety? How can we make you feel safe and secure emotionally so that you can carry that in with you to different areas? If it's at law enforcement, the police department, if it's in this area with us, if it's at school, whatever situation you're in, how can we build your confidence? How can we build your emotional safety so that you're able to carry that with you? So we do a lot of work in focusing on coping skills, which sounds kind of, oh, it's coping skills, like how do you cope? But when somebody has experienced trauma and their brain is telling them, I'm unsafe, they're not able to just say, okay, I need a break, or I need to step back, or I need to do something that makes me feel happy, because your brain goes into like that fight, flight, or freeze mode. So we work a lot with our survivors in helping them identify those signs, whether it's the physical signs. What does your body feel like? Does your breathing change? Do you feel your hair stand on the back of your neck? We work with our survivors to identify those things so that something can start registering with them. Wait, I need to take a second, or I need to do this. What can make me feel better in this moment? So the advocate was able to explore art with this survivor and really got into that, and she loved it. The survivor also identified that she was feeling very isolated and wanted to engage. So the advocate was able to take her to a statewide survivor event in Madison, and she was able to meet hundreds upon hundreds of other allies and survivors and advocates, and know that she was surrounded and supported in that moment, and just really build a lot of support. And we were also able to help her create an awareness event at her school and support her, because she, it may have been nerve-wracking, but she wanted to get out there. She wanted to show she didn't want to be so isolated, and that was what she identified. And so going through this process with her and working with her, she was able to come back a few weeks later, and she actually contacted her advocate and said, "I'm ready to report." And so we were able to give the control back to this survivor, essentially. This was on her terms. She was able to wait until she felt she had the tools and she had the support to go in and report. So her advocate went and reported with her, and her advocate was with her every step of the way through the court process. And just to show how impactful this was, is that by the time the sentencing came around, she was freshly 18. But she stood in front of the perpetrator and the judge and everybody, and stood and gave one of the most impactful statements to the entire courtroom that even wowed the judge. And she brought in her art, and she was able to do that and feel safe and supported and confident in that, because her advocate, who's in the room, by the way, her advocate put so much time into recognizing what's going on in these moments. What do you need, instead of like, I know how to help you, or let's just focus on reporting, let's just get through this. She approached it with trauma-informed approach, and took those steps with her. And now the perpetrator received a sentence, and we know this wasn't his first victim, but fortunately this will be the last, because we were able to take our time. So.
Thank you. Michelle, if you would.
Sure. So sometimes a disposition that we can look at for someone who's charged with a criminal offense is probation. And a lot of times the arguments that we're using for probation, or why we think probation is appropriate, is because we think that this person needs some services, and they'll get a probation agent, and the goal is that they'll be connected with resources in the community. Now I will say, I don't know if it's just that. I think there's a lot of factors. I think insurance is one of them. I think either there just aren't a lot of resources, or we're not connected with them. But if someone, if a probation agent says that someone has, committed violations or failed their probation, they can be revoked. And the consequence of that is either being sentenced to a jail sentence, or if they were on something called extended supervision, being sent back to prison. And we represent in those cases as well. So my work prior to being an assistant state public defender was in juvenile mental health. And so I use that trauma-informed lens in everything that I do. So when I started taking these cases and working on these cases, a lot of my clients who had addiction problems, we go out and we interview them, and we're really using that lens when we interview. And so one example is someone who had used heroin, and that was one of his violations, but then he also had a violation at the jail that was kind of not, people said it was unprovoked, they weren't sure where it came from. So through interviewing him, we did uncover that when he was about 5 years old, he did walk in on his father who had hung himself. And then, and this information had never come out before, and it's either because the questions weren't asked or just because he didn't share it. And then further down the line, he did lose his parental rights to his daughter. And for that was him kind of doing the same thing that his father did to him. Now, we also found out that the day that this incident occurred, that was the second violation, was the anniversary of the day that he lost parental rights. So with all of this information, I've actually used the Wisconsin study on ACEs, so this adverse childhood experiences, this study that was done, I believe it was back in 2010. I think it's a little dated, but I still use it. And it just talks about both how, the number of adverse childhood experiences the people in Wisconsin have had, but it also goes into making recommendations for how the various service providers in our different agencies should be using that information to then give people treatment. And so I use that to argue, and the department, the agent wanted this particular person to just go back to prison for the rest of their extended supervision time, which would have meant that they were just released back to the community and they're done. I argued to send them back for half the time as their punishment portion, but then save half the time so that we could really get them, shaking the table, really get them into the treatment now that we've identified these very traumatic experiences and identified that thing that happened that resulted in the second violation was really that his brain was affected back when he was younger, and it really puts you in that, like she said, the fight, flight, or freeze. And so identifying that and then having, his agent having that information so that when he is back into the community, now let's get him in the right treatment and let's give a counselor that information so that they can address that head on. And then the administrative law judge who hears those cases agreed. And so he was able to come back to the community with time left on supervision to get into some treatment that directly could address that trauma.
Thank you. Is there anyone else on the panel that would like to address that question? Oh, please.
One of the things that I think is really important is building that relationship, because like she said, no one had ever really asked the right questions. And even if you ask the right questions, if the individual does not feel like that they have a relationship with you, they're not going to tell you the truth anyway. And another huge piece with this process, and again, she gave a great example, is those behaviors weren't just naughty, negative behaviors. It wasn't someone just trying to be bad. That behavior was a language. And sometimes we don't always listen to the language that other people are giving us to look at the situation for what it is. I have a couple of clients that I work with. I have one that paces my office. If his mom's in the room, sit down, talk to her. No, he's fine. He can wander all he wants. Because if that's what he needs to do to feel safe, if that's what he needs to do to feel supported, then that's what he needs to do. And I think it's so much easier with high caseloads, being very busy, trying to take care of our own junk, that we don't always see the behaviors for what they are. We want to just slap a label on them and move on. So when we do look at situations through a trauma-informed lens, and we build that relationship and we can correctly identify what behaviors we're dealing with, it brings an entirely different picture. Many years ago, I had the opportunity to sit in on many care house interviews. And this was back in the day when multidisciplinary team approaches was actually a new thing. And we put together a case example and presented it at a conference. And our presentation was about a particular juvenile who had been arrested for a sexual offense. And each, from the DA's office to Human Services, both from Child Protective Services and from Juvenile Justice to law enforcement, when we put our entire histories together, it was a completely different picture than when we had one of those pictures. So part of that lens is when we all come together, we can do some pretty amazing things. But none of us individually, are gonna actually solve any of the issues that we have before us.
Mm-hmm. Thank you. So, thinking about having a different lens or different lenses to look at individuals or families, I'm going to throw this question out to anyone on the panel. Have you looked back and thought of a person you dealt with in the past whose behavior makes more sense to you now that you understand the impact of trauma?
I'll go. I have one just today, matter of fact. So it's nice and fresh in my brain. One of our inmates who I've dealt with since he was a juvenile, like I said, I've been doing this for a long time. He just presently got out of jail, but he's been in jail. He actually was just incarcerated for 2 years in the county jail for offenses that he's committed. Most of those offenses are related to drug-related offenses due to his addictions. I've known this gentleman for many years. Like I said, I've chased him many times out on the streets. I've chased him at his house. And he's a medical nightmare right now. He's had to have reconstruction of his sinus cavities from doing so many drugs. He has to have a catheter because his body's failing because of this abuse of substances and so on and so forth. But I've always had a good rapport with him, a good relationship with him. I mean, there's times that I've had to chase him and he gets tired and he just sits down and I get up to him and I'm too tired, so I sit down next to him and I throw him the cuffs and tell him to put them on. And he does. And I said, are you going to run before you walk back to my car? No, and he walks back to my car. That's the kind of rapport we've had. And he just presently got out of jail, but before he did, he started our Vivitrol program, our MAT program that we have at the jail. And he came to me and asked me about that program because the MAT program, as Katie can attest to, just changed some of their criteria so we could allow it for inmates that are on Huber and so on and so forth. So he came to me about a month and a half ago and asked about the program. I said, absolutely. If you want this program, I would love to see you do it because I want to see you live. I want to see you fulfill the rest of your life without having to deal with this addiction. Not that you ever stop dealing with it, I don't mean it that way, but can move on with it and hopefully go on with your life and not keep going down this road, not have to keep coming into jail. So then he just got out just a couple days ago and he got on the Vivitrol program. And I'm hoping and praying that he'll continue with that when he gets out. But to go back to the whole point of trauma, when I was arresting him as a young child, again, this goes back to us not knowing things that we should have back then. But he was raised in a family of an abusive father, a mother that couldn't do much because she was addicted to drugs, and the father was addicted to drugs. And he grew up with a very parentless home back then, and we knew that. I mean, because he was out running free and committing crimes and doing things. In my opinion, idle minds are dangerous minds. If they're not kept busy, they will cause problems. So I look back at that, and I look back at his trauma, and I never recognized, and back then, that a lot of it was his parenting, a lot of it how he was raised, and the trauma that he went through, the trauma he saw that he just witnessed himself in his own home with the abuse of his father, with watching the abuse of his mother, and the addiction that was going on in their home between just polyuses, between alcohol and drugs. To this day, we look at that a lot different now. And that's one thing that we've learned through all this training, through the trauma-informed training, that we have to start looking at things differently. And I go back to what I said before, let's start treating the root causes of why people are doing what they're doing. And I'm not giving them excuses. They still have to make choices, and they still have consequences for their choices. And that's part of what we do. But we're getting better at not just throwing people in jail, but finding out why and treating those issues. Thank you.
I'm just going to bring up an example that I first experienced early on in my career back in '81. I know it was a long time ago, but
I was 9.
Thanks, Mark. Yeah, so I was working in a residential treatment facility for emotionally troubled adolescent boys, and we had a kid that we were working with. He was actually a triplet. He had a sister and a brother that were, and so I worked for this agency where we would have these kids in the residential treatment program for approximately a good year to 2 years. And he did have a history of aggression. We knew that his family background was not very good. In fact, it was quite toxic. But he had a pretty good rapport with me. And one day he got upset and he just started becoming physically aggressive toward me, and myself and some other staff had to restrain him. We were taught techniques on how to do that, but we restrained him, and then we had to put him in a quiet room. And his behavior came totally out of the blue, and I was just like, where did that come from, you know? And I had no idea. I'm like, this is like out of character for him to act this way towards me. Well, when he was able to calm down, I met with him, and I asked him that question. So what was going on just, you know, when you started to, you know, get aggressive like that? Well, from what I've been able to establish from my conversation with him was that he actually disassociated. And he said, I had this flashback of this neighbor who abused myself and my siblings, and all of a sudden, for a moment there, I thought you were the neighbor. And it was back then that I realized that trauma was playing a role, okay? But we didn't have the buzzwords we do now. But that's when I realized that, yeah, trauma definitely plays a role here, and that's what caused this person to react so strongly. Because when you have somebody acting that quickly, that angry, and that quickly, it's not about the present trigger, it's about the past. So, and because of that, we were able to kind of work through that and help him. And he never had another episode like that, at least not with me that I remember, so that was the only time. But that was the time when I look back and I go, yeah, trauma definitely played a role here. So, thanks.
Oh, thank you so much. Yes, please.
Yeah, I'll make it pretty brief, but in my former career prior to as a school counselor I currently am, I was a special ed teacher for students with emotional behavioral disabilities, and I think, again, like we've heard, when I first started and, didn't know much or have much information about trauma, and I think now back to some of the students that I might have worked with that were referred, an initial referral for special education because of behavior, I often now kind of wonder, was that truly an emotional behavioral disability? Or was it something I didn't know about or didn't think to ask about as the evaluator looking to see if the student needs to meet criteria as a student with a disability? And there certainly are a few students now that I think back to that I question, did I really make the right decision in qualifying or identifying them with an emotional behavioral disability when truly it may have been more of a trauma experience? And not to say that, the services received as a student with an emotional behavioral disability certainly helps someone, but did we have to put a label on something that maybe shouldn't have had that, significant of a label? And so I think that has really helped me and helped in supporting other educators and other special ed teachers too. And we really do need to recognize when we're looking at those behaviors, and I know there's been cases, I'm currently in middle school, but I know I've talked with, even individuals now that work in elementary schools of, some of the staff really saying, you've got to, it's a kindergartner, this behavior's out of control, he needs to be, he needs to be in special ed, he needs to be identified. And when you look at what he has experienced in his life in the short 5 years that he's had, and you think, there's no way we could be putting a label on that right now because we haven't dealt with the trauma that he's had, and maybe looking at that and supporting that and giving the services we need for a trauma situation could keep him from having that label and that diagnosis, which isn't going to necessarily fix things either, and sets them up with that label as they carry on through school. So certainly there has been a lot that I've reflected on now more and more that I've understood trauma and the differences and the similarities with ADHD and the behaviors we see with students that have that hyperactivity. And oftentimes when they're getting medicated, that's really, and we say that, the medication isn't working, it's not working. Well, probably because we're medicating something that isn't ADHD. And oftentimes some of the behaviors we see in the classroom with students that have had significant trauma mirror those of a student with ADHD, but those medications aren't going to help when that's not hormonally what's going on in their bodies, and we're not dealing with the actual, the issue of trauma, so.
Thank you all for that. So, sorry, going through my brain was when I was a 22-year-old summer camp director working with children with HIV, and thinking about that a number of those kids were survivors of sexual assault back in 1995, as I'm dating myself, but thinking about what that experience would have been like for them had we known what we know now, and not I had people of your caliber and your expertise to guide and support me. So really appreciate just all the work that you're doing. So, our last question for the panel, and again, this is open to anyone on the panel. Can you share an example of a family where the cycle of trauma has been broken through intervention? Yeah, please.
So in anticipation of this panel tonight, I am a clinical social worker, but I haven't practiced for a long time. But I was just asking some of our clinicians and social workers who work with families and direct service providers about their experiences. And so this question was responded to by one of our therapists who described a family that she worked with, a mom who had been very involved in our child welfare system, involved in our emergency mental health services, had a history of aggression and suicidal thinking, and had a period of time where she had a lot of aggressive thoughts toward her children. And so that is a pretty scary thing in the world of child welfare at all, right? About a mom who might have thoughts about harming her kids. And so there was a lot of stigma around that and a lot of shame. And people were scared of her. And the therapist who was working with her described to me that through their work together, they were able to determine that her approach to being aggressive and threatening to others was really an adaptive skill. That's how she had learned to cope with being sexually and physically abused as a child and having to fight her way out of really scary situations. And that was really her biggest strength, was the ability to fight. And so she turned a lot of people off. A lot of people didn't want to work with her. She was like that client. They were like, oh no, you know. But they hung in there and provided really solid team treatment for her. And the way the client then described, she was really able to make huge improvements through some focused trauma work and really just solid, trusting relationship. You know, it's all about the relationship. But when asked later on, she was able to be reunited with her kids. And so this family story that was going down this path of foster care and trauma for these children and repeating a cycle was able to be really turned around because mom was able to understand how her behaviors and approaches were her own adaptive skill, and then to learn other ways that she didn't need to do that anymore. But one of the things that the therapist said that mom said about what made a difference, because she was able to make such a dramatic change, that the therapist, you know, wanted to know, like, what was helpful to you? And what she said is that you held hope for me. You know, you were able to be hopeful about my future and my ability to be a mom and provide safety for my kids and to not be this angry, risky person. You held that hope when I didn't have it, and that's what made the difference. And so I thought that was a great story.
Mm-hmm. Thank you for sharing that. Anyone else on the panel would like to address that question? No. All right, so thank you for the question. Children in foster care have typically experienced trauma prior to being placed in foster care. However, the act of removing a child from their family is an additional trauma. How can we work to keep these kids safe while simultaneously, 1, prioritizing keeping families together, and 2, helping address the needs of the parents who often have themselves grown up in trauma and who may not have adequate resources? Thank you for that question. Anyone on the panel?
I can jump in on that.
Yep, please. Thank you.
Yep. So thank you for that question and for saying those things out loud. And so I just want to affirm how important it is for us to recognize that removing a child from their home, even when there has been abuse or neglect, is we've added another ACE score. You know, we've added another trauma. And so we have to be able, as a system of care and as a community, we have to be able to think about safety for everybody. And so how are kids able to be safe in their homes? What is the barrier to safety? What does mom or dad or caregiver need in order to keep that child safe? Many times, a lot of our, if you look just nationally across the country, removals from homes are related to neglect much more than they're related to abuse. And what does that say about us if we're removing children because the parents are neglecting their needs? we have to be able to help families do a better job of meeting those needs and keeping kids safe and keeping them connected with family. And so I think the way we keep kids safe is to be able to get creative about how do we insert services into a home to be able to provide that safety services within a family system without removal. We have a lot of that going on right now in the Human Services Department, and that in-home safety services model is really growing. I think also it's about how do we make connections with other family and kin and like family who can be a support to that child when parents aren't in a position to keep that child safe, and how do we really foster and keep kids and families connected to their families and those who they already have relationships with. And I think, how do we help? We have to be able to thinking about what do those parents need to be safe? And again, I'll go back to psychologically safe. You know, what's going on for that parent that they are not able to meet the needs of their child, and what do they need in order to feel safe themselves? And again, a lot of that is that helping to approach relationship with trust and positive regard, and being hopeful for them about the fact that things can be different. So a lot of it, I think, as a community, we have to think really differently about the child welfare system moving forward, and how we approach situations when we have reason to believe kids aren't safe in their homes.
Thank you so much. Anyone else? Oh, please.
One thing that I've seen in the law enforcement career, and as Kate can attest to that, a lot of times we look back at it as physical abuse and neglect. But a lot of people forget about the emotional abuse and the trauma that is caused by psychological abuse also in a home. And that's something that I still think we're edging on learning more about, and that we've always looked at it from a law enforcement side. If you're physically abusing your children or you're neglecting your children, we can arrest you for that. But there's not a lot out there for the psychological portion of it or the emotional side of it. So it's something we still have to learn a lot about, and it's a lot that we're still trying to grasp, get our hands around, and learn that there's more to it than just the physical and the neglect. Because again, part of that emotional and psychological is abuse, and how some of these kids are being treated, and what's going on in their household. And it's a vicious cycle, unfortunately, and we have to try to break that cycle. And it's a very hard job for human services to try to do, because they're raised in that environment, and then it's a cycle that they tend to, as we all know, through racism, through trauma, that they may repeat that cycle. So it's very difficult for us in law enforcement to try to identify that and then try to deal with that. We don't have the tools. I'll tell you that right now. Law enforcement doesn't. That's why we need everybody at this table to collaborate with one another and to work together so we can get to the bottom of these kind of issues and try to deal with those subjects. So, thank you.
Yes, thank you. Please, Michelle.
Yeah, I think that's a really, really important question with a lot of dynamic responses to it. Statewide, we do have a bit of a crisis in out-of-home placements right now. We used to have a lot more group homes than we do now. So many of them have closed for different reasons. I know it's really challenging sometimes to find appropriate foster homes, especially with the level of needs that some of our kids have. And so I think it's a really important question because if you look at a situation on a very surface level, it can be easy to say, that kid shouldn't be in that home. So I do appreciate a lot of the work that the county workers do in really looking at that question deeply, and is there something that can be done in home, a safety plan, things that can be done first to keep the kids in the house and still have it be safe. On my end, so in the court process, kids who are under 12 will typically have a guardian ad litem appointed who looks at the best interest of the kid. Kids who are 12 and older will get an attorney appointed. And one of the things that I really focus on, one of the things that made me interested in being a public defender who represents juveniles, is that there's a lot of studies about how the process that happened with that juvenile, if a child feels like they had a voice, if they felt like their voice was important and they were heard, just that process itself has a greater impact on their development and their view of the system and their, in juvenile justice cases, their recidivism rates, than what the outcome was. So I really try to focus on, in every hearing having to do with a kid being placed out of home, making sure that kid has a voice in the process, and making sure as best as I can that that voice is heard. And sometimes that means that I have to make, I have to be their voice. So if it's a kid saying, I want to go back to a home that other people are saying is not safe, I have to be that voice. I also have to trust that other people in the system are doing their job too, so that I can feel comfortable being that voice, even if the non-public defender part of me worries about that kid going back to the home. I have to trust everyone else in the system is doing their job. So.
Anyone else would like to address that question? Okay. More questions from the audience, please?
I'd just like to say that there's an organization that just became independent in Rock County. It's called CASA, Court Appointed Special Advocate, and that's a volunteer person who is assigned to children who are in foster care that is a voice for them also. So it's a super important organization that more people should volunteer for it.
Thank you for that information. Absolutely. Any other questions or comments from the audience? Okay. I want to give our panelists one last chance if there is a nugget of wisdom or a lesson learned that you have that you didn't get a chance to share.
I have one more thing.
Oh, please.
Ooh, maybe. Yeah.
You got it?
So many obstacles. I think this was already touched on a little bit, but I guess one of the things that I wanted to add was that while we all have our roles up here, and there's several other service providers in the community doing a lot of good work, it really is a team approach. And you talked a little bit about the creation of multidisciplinary team and that approach, but the way that trauma impacts somebody, whether it's something they've directly experienced, whether it's part of their generational history, however that is, and so the way it's experienced and the way it impacts their life is so different. It cuts across so many elements of their life and impacts them, that it really does take an entire community to help somebody overcome that and to find a life where the trauma doesn't negatively impact them anymore. So with our services, we almost never stand alone with the people that we're working with. We are always surrounded by other service providers that we work with. I think almost everybody up here, or the organization that we're with, we've worked with, because it can't just come down to one service provider, and that interaction, that reaching out, the communication is so instrumental, and that's really where services have gone above and beyond. When that person you're working with that has experienced trauma, they know they're surrounded by a team, and that they know that they can come to that team, and that what their needs are, that those needs will be met because we're willing to work together, we're collaborating. And Rock County's done, especially in these last few years, a really amazing job of doing that. And so it's been wonderful, and I think we've seen a lot of really positive improvements in the community and the people we're working with, because we've really worked on improving our collaboration and surrounding the community with support.
Thank you. Anyone else? So first and foremost, can we thank our panel of experts? Thanks for all the work that you do every single day. Thanks to the Rock County Trauma Task Force and Janesville Mobilizing for Change for organizing this. This is amazing. I hope it's the first of many community conversations like this. And then thanks to all of you for being here this evening. Really appreciate that, and for all the work that you do in the community to improve the lives of everyone, to improve the lives of others. So with that, I'll turn this back over for closing comments, and I'm going to get off the stage.
Thank you, everyone, for coming. Thank you, panel members, for all of what you've contributed tonight. I'm really happy with the way that this event has gone. I think there was a lot of great information shared tonight. And so thank you, everyone, and we'll have a snack.